Last month, something strange happened. Millions of Americans walked into their pharmacy, handed over the same prescription, and paid less asterisk. No coupon, no discount card, no ask your doctor trick, just less. And almost nobody noticed, because this wasn't a sale. It wasn't generosity. And it definitely wasn't Big Pharma suddenly finding its conscience. This was the quiet start of the biggest shakeup in Medicare drug pricing in U.S. history. And depending on what medications you take, it could save you hundreds or thousands of dollars a year, or almost nothing at all. Let me explain what just changed and why the math behind it is way more uncomfortable than it sounds. For decades, Medicare had a strange rule. It paid for drugs. It covered millions of seniors. But it wasn't allowed to negotiate prices. Imagine running the biggest hospital system in the country and being forced to pay whatever price the drug company writes on the box. That was Medicare. Private insurers negotiated. The VA negotiated. Even small health plans negotiated. Medicare out. And every year, seniors paid the price. Literally. Until now. Because in 2026, Medicare quietly flipped the table. The government just negotiated prices for a small group of very expensive, very common medications. These aren't rare drugs. These are drugs millions of people take every single day for diabetes, heart disease, blood clots, autoimmune conditions, cancer. Some of them cost over $10,000 a year per person. Medicare picked the biggest budget busters first, the drugs that drain the most money from the system. And then, for the first time ever, it said, "This is the price we're willing to pay. Take it or leave it." The companies didn't leave it, because Medicare is too big to walk away from. Here's the mistake people make. They hear prices dropped and think, great, my pharmacy bill is going to be cut in half. Sometimes, yes. Sometimes not even close. Because Medicare doesn't work like a normal store. You don't just have one price. You move through 4 different stages of drug coverage, and each one has its own math, rules, and traps. Let's walk through it slowly, because this is where the real story is. Stage 1 is the deductible. You pay 100% of the cost until you hit it. Stage 2 is initial coverage. You split the cost with your plan. Stage 3 used to be the donut hole, that weird phase where costs exploded. That part is mostly gone, but the math is still messy. Stage 4 is catastrophic coverage, the phase where you've spent so much money that Medicare finally steps in heavily. Now here's the twist. The negotiated prices mostly reduce costs in the early stages, not the later ones. So if you take only one expensive drug or hit catastrophic coverage every year or have extra help or subsidies, your savings might feel invisible. But if you're a normal Medicare user, the kind who takes several common meds, never hits. It's catastrophic coverage and pays monthly at the pharmacy counter. This change hits you right where it hurts most. The register. Let's do a real example. Diabetes drug that used to cost $500 a month now costs $300. That's $200 saved per month. Sounds great. But here's what Medicare doesn't advertise. That savings is spread across your deductible, your coinsurance, your plan's share, and Medicare's share. So you might not see the full $200. You might see $40, or $60, or $120. Still real money? It's not the miracle headline. And that's where the tension lives. Here's the ironic part. The people who needed this change the most, the sickest, most expensive patients, often see the smallest difference. Because once you hit catastrophic coverage, you were already protected. The biggest savings go to the people in the middle, not healthy enough to avoid meds, not sick enough to hit the ceiling, the forgotten middle. And for them, this is the first time in years Medicare actually feels like it's working. But this is just the beginning. Medicare is adding more drugs every year. And that's where the real fight is coming, because drug companies aren't just sitting quietly. They're already raising prices on non-negotiated drugs, shifting costs to private insurance, adjusting which drugs they push hardest, redesigning pricing structures to stay profitable. The savings you see today could be offset somewhere else tomorrow. That's the game. There's also a risk nobody likes to talk about. When governments control prices, companies change behavior. Sometimes that means fewer discounts, sometimes fewer options, sometimes slower innovation. Nobody knows yet. This is an experiment on a massive scale. Seniors are right in the middle of it. So yes, Medicare drug prices just dropped. For many people, the savings are real. But the bigger question isn't what you save this year. It's this: if Medicare can finally negotiate prices, and drug companies still find a way to win, actually pays the bill in the end. Because in healthcare, the money never disappears, just moves, and where it lands next might surprise us all.